Cue the tricky music. There it is. All right. Hey, that means we're live. Stages of Life Radio live on a Sunday afternoon at 4:06. How you doing? Hey, Doc.
It is good to be here in sunny Central Florida.
I know, right?
It just hasn't started raining yet.
Not yet. No, it's been threatening all day. There was like a little bit
It's
of
out
a
there
mist.
spitting.
It is still spitting.
Yeah, just enough to ruin your wax job on your car.
Oh, I know. It's like, oh man, my windshield. Dang it. All right, so the lines are open, wide open too. 407-422-1212. Get on board. You got a question for the doc? He's got answers, and he loves the tough questions too. If you want to bring on something that's impossible, and you think, he's like, give me a minute. Do carry the two, and yeah, and I mean
Next,
that's yeah.
Well, actually, most of these things that look really, really complicated aren't.
Yeah.
You know, I mean, in my line of work, I like getting difficult, tricky cases because it's challenging and it's fun, but it's also easier because all of the usual stuff has been parsed out. That is most of the usual stuff. So yeah, so it's been an interesting week for oddballs coming through, things that just really didn't expect to happen. So, you know, there's a reason I'm not a pediatrician. Okay, and the reason is that I just don't get along that well with kids. They don't like me very much, I don't think, and I don't understand them. They don't understand my jokes. In fact, the mothers typically don't understand my jokes either. So we had this is really interesting, in the day of COVID. So I had an 8-year-old girl who came in, you know, for a COVID test. Now, this is not all that common. We get about 30 adults for every child that comes through. But kids coming alone just doesn't seem to happen unless they're teenagers. A little different, or college kids, a little different.
Right.
So this kid's screaming, okay? And I'm thinking, well, all right, that's really why I didn't go to pediatrics. I mean, it's
'Cause
distracting.
You don't like children.
It's distracting to hear kids screaming. Because a regular guy is going to want to try to fix whatever it is. And most of the time, there is no fixing anything. So we did what's called a lateral flow immunoassay COVID test on this kid. You'll know it as a finger stick. So she came in. You know, we could have done the nasal.
Wait, the finger stick?
The finger stick.
Okay, which is nothing.
Of course, well, it is, but when you're scared. So little kids cry because they're scared. Well, if you've ever had one of these things, they don't hurt.
Yeah.
They certainly don't hurt after the poke.
Not at all.
So, you know, she's just carrying on. So she's scared to death, or something else was bothering her, right?
Mm-hmm.
All right, so what don't you want in your office? Okay, if you think somebody has COVID, you don't want them screaming, okay? Because, you know, that's just going to spread the stuff all over the place. I'm thinking I'm a regular soldier. I'll go out there and I'll do what I need to do, but I don't need somebody shooting at me. Not my people, anyway.
Right.
So, you know, I walked over, and so I introduced myself to the child and the mom. And so she's sitting there crying, you know, almost uncontrollably, and you know, the test was over. So I asked her, I said, what's bothering you? And what was bothering her was very, very clear. She was scared. So I told her, I said, look, chances are 99% that you do not have COVID. So mom says, well, how would you know that? I said, from looking at her.
Yeah.
I said, A, she's not short of breath. B, she has no cough. C, she doesn't have that look.
And D, she's in the tender age where they don't necessarily get it.
Yeah, and more so, no fever. You know, we've had lots of people come through with COVID. Not one of them actually had a fever. So go figure that one out.
Right?
Yeah, okay, well, that's the telltale sign is fever.
No.
Yeah, no, I don't think so. And we actually do it by sticking the thermometer in your ear. So it's not like this temperature across the room nonsense, which, by the way, doesn't work.
Right.
All right, they don't work. I have 2 of them I wanted to evaluate against my machine. They didn't work at all. Even if you were within a half an inch of the skin, they did not work. It was nonsense.
Really?
Yeah, and so, okay, fine. So I wait until the IA comes back. It's about 12 minutes. It comes back negative. So the kid's still crying. I said, well, look, may I get a look at you to figure this out? While you're here, you know, you'll get your $49 worth out of this test, right?
Yeah.
So, you know, I actually said, well, what's wrong with your kid? She goes, oh, well, she has a bump, you know, swollen lymph node under her left chin. I said, well, that's interesting. May I get a look? So I looked down her throat. It's not red, not at all. Nothing on the tonsils, nothing, zero, nada. Just clear. I mean, my throat isn't that healthy looking. And so I figured, all right. So I said, can I feel the node? Mom says, well, you got to be careful. She's very, very tender. I get it. Okay, she's crying because she's hurting. So I feel her on the back of the neck, you know, behind the ears, down the neck. And when you have viral illness, viral infection, those are the nodes that typically get tender or large first. They were not. They weren't even palpable. They were not there. Figured, oh, okay, what else could this be? Possible? It could be strep throat. Kid could be a carrier. So I poked around the angle of the mandible, which is where the lymph nodes typically swell from strep throat. Nothing there. Huh. Okay, now you've really got my interest. So I start moving my way anteriorly towards the tip of her chin, and she's got one ugly bump of a gland under the mandible, right about halfway. It's a submandibular gland. I'm thinking, that's pretty cool. How long has this been going on? Okay, well, a few weeks. All right, so she has COVID because this has been going on a few weeks, right?
Oh,
okay,
no,
yeah. This, okay. All of a sudden, it's starting to become amateur hour again. And so I asked her, I said, let me ask you a really stupid question. Does food taste funny to you? And the little girl looked up at me and she stopped crying, her eyes widened. She goes, well, yes. I said, really? I said, how does it taste funny to you? Now, kids, by and large, aren't very articulate when it comes to describing things. So she goes, well, it just tastes funny. I said, do all foods taste funny? Then the mom piped in. And she said, well, that's why I've been giving her, I think she said applesauce and yogurt or something like, some combination like that. And I'm thinking, okay, I got this. So I asked her, I said, what would happen if you gave her a slice of pizza or some spaghetti? She goes, oh, that would drive her nuts. Okay, now, what is the diagnosis? Okay, so the diagnosis is something called sialadenitis. Okay, what does that mean? Sometimes the glands clog up, just like if you had a kidney stone. They little tiny inspissation is the doctor word. If you use doctor words, you can charge more. So for those of you that are thinking of going into medicine, that is a very important lesson.
Write that down. That's a pro.
Big words, polysyllabic, so you charge more. You look erudite. What you do is you look up towards the corner of the room and then out towards the horizon as you come up with your diagnosis, and then people will really think you're smart. So I asked, I said, look, what you got here is really pretty simple. I said, this lymph node is not a problem. Okay, COVID is not the problem. I said, what you have is something akin to mumps. I said, and it doesn't look like mumps because there's no bilateral issue to this. One lymph node or one gland swollen like that is not typical of mumps in a child. Can be in an adult, but not in a kid. So I told her, I said, the likelihood of this being mumps is very, very small. More so the kid's 8. She was just immunized 6 years earlier, so it's unlikely that would be the case. I said, but a salivary gland going bad is a big part. Mm-hmm. So we went ahead and treated her. High-tech, very expensive medications. Okay, so we used something called N-acetylcysteine, which used to be called Humabid. And so what this stuff is, it's a mucolytic. We use it for colds now, common colds, because it helps break up the secretions in your chest. It's great for asthma, it's good for pancreatitis, and it costs about $23 a bottle. Excuse me as I clear my throat. Secondarily, we used Mucinex. And then the most important part of the whole recipe was a sour lemon ball. A sour lemon ball. Why would you do that? Because then the salivary gland starts to spew out the saliva and clear itself out. It's like blowing out carbon out of a muscle car. That is how you handle it. So how many of these people running around scared of their shadow because of COVID? It's a lot. We have 10 million cases of COVID in this country and 340 or more million people, which means you have really one chance in 34 of having had it or have it right now. That doesn't sound like everybody's going to die. This is not The Mask of the Red Death by Edgar Allan Poe. This is a bad problem, but don't be scared of your shadow and everything that goes on with you. Everything that's wrong isn't necessarily or is in fact likely to be due to coronavirus 19 or any of the other 49 coronaviruses that have been identified. So that was what I had to share with you because it was really pretty cool. I actually felt like a real doctor for about 30 minutes. It was a good feeling to be able to help that kid out.
Hey! And we got some questions, we got some texts to answer, lots of stuff to take care of very shortly. But first, we must take a break. If you want to get on the line and ask a question of the doc in person, give us a call, 407-422-1212. The text line is also open at 23680, and we already have a couple of questions lined up there. Yep. So we're going to take this break, and like I said, we'll be right back. You're listening to Stages of Life Radio, and yeah, buddy, we are live right now on News Radio WFLA, Orlando. You clear for now? Oh, look at all these questions. Okay, let's see here. Hold on. Where are you? Boop. There we go. Is there alternatives to having a mesh procedure done for an umbilical hernia?
Yeah, well, the mesh is only the means by which the hernia is repaired. So what a hernia is it's kind of like if you imagine a balloon within a balloon, okay, and the outer balloon is holding the inner one in, but then something happens to the outer balloon to allow the inner one to kind of work its way through, work its way out. That's what a hernia is. It's a balloon popping its way through the outer shell. Now, you also have hernias on the inside, okay? So you're a series of bags, if you really want to know about it.
That's
nice. That's just a great way to describe it.
That's really, really
So
nice.
what the mesh is
Poetry.
the means by which you pull the tissue together. Because if you put a suture through muscle, it just rips. There is no strength to muscle tissue, but there is in the fascia around it. But if the umbilical hernia or any other muscular hernia, if the tissue attenuates or thins out, you use the mesh because you have to have something to tie everything together. So if that umbilical hernia is of sufficient severity, you may need to use the mesh. And frankly, surgeons don't like using mesh.
No.
Okay, so when they go for it, it means you got a problem. When do you really figure this out? You figure it out after you've gotten a look at it. So yeah, I've got an umbilical hernia. When it gets repaired, if it gets repaired, there won't be any mesh necessary. Now, what I'm going to suggest that you do for your umbilical hernia, and I'm going to assume that it's not enormous. If it's enormous, just expect to use the mesh. But if it's the usual thing that's the size of a cherry or the size of a peach or something like that, get an abdominal binder. Okay, and what this thing is, it's a bit of elastic.
That's what you get.
I had one. Okay, it's an elastic thing that kind of wraps around you and holds you together, and then the tissue will start to mend itself, making the hernia smaller and easier to put back together. How long does that take to happen? The answer is 4 to 6 months. An abdominal binder, you can go on Amazon and get them. Don't buy the old cheapos because the first or second time you wash it, they'll fall apart. So get a good one.
Pro tip.
Get the largest, yes.
Get a larger one.
Get the largest one that makes sense for you to wear, because the broader that they are, the better this is going to work out. And this is not like a belt. This thing, it's sacroiliac belt.
No.
These things are more like mini girdles. They will hold you together. You'll actually feel better with it. And after a fairly brief period of time, just a few months, the umbilical hernia will start to get smaller. And in that way, it'll be easier for the surgeon to handle it. So that way, you may be able to avoid the use of mesh at all.
Nice. It's not that long a time. It's 4 to 6 months, Tony. Come on now. What's worse? The alternative is worse.
So it worked for me. And this is something that I've been telling people for a long time. And so, when was it Doc, why don't you do it? And I'm thinking, oh, okay. It never occurred to me, I'm like the answer man, not the questioner.
Right.
So what happened was I went out and actually I bought one, used it, worked beautifully. And my wife bought me another one in case the first one goes bad.
1 minute. Less than.
Good stuff. What do we got? Anything else up there?
No, just Tony saying thank you and laughing.
There we go.
In about 45 seconds, I know we had a call come in, and we've also got
one of the things we're going
to
we'll talk about in the next segment. Okay, if anybody's interested, is what to do with this COVID vaccination nonsense. Okay, which is a great problem to have.
30 seconds.
And I'll be only too happy to answer questions on that, as I have all week.
Yay! Same day surgery, he says, for the mesh.
Yeah.
Okay.
Yeah,
yes.
if it turns out that way, sure.
All right, stand by. We are a radio station and only play 30-second excerpts of songs anyway, but we pay licensing fees because we love artists and musicians.
And we like staying out of court.
But yeah, that too. Welcome back at Stages of Life Radio, brought to you by Stages of Life Medical Institute in beautiful Longwood, Florida. They are open Monday morning. Give them a call if you like, 407-679-3337. Or better yet, go to stagesoflifemedicalinstitute.com. Poke around there. You can become a new patient. He's always accepting new patients. Okay, we've got some texts. We've got some calls to take care of. Let's go ahead and take Kathy's call.
Sure one.
Yeah.
Let's go for it.
Yeah. Hey, Kathy, you're on with Dr. Klein.
Hello?
Hi, Kathy, you're on with Dr. Klein. What's going on?
Hello, Dr. Klein. Dr. Klein, I'm wondering if you have a pre-existing condition such as Guillain-Barré or something like that. Should you take the vaccine, or could that trigger a problem?
Oh, Guillain-Barré is actually a very particular one. Guillain-Barré is an autoimmune dysfunction, disorder, disease of the neuromuscular junction. So your body develops antibodies to the neuromuscular junction. You start to weaken. It's kind of an interesting problem. Your eyes start to droop. You really can't function very well. There are medications that you can take to help. There are certain vaccines that are known to cause Guillain-Barré. If I had Guillain-Barré, that's about the one disease that I would probably wait on the COVID vaccine to see how things pan out. Because that would be the one. That would be the one. That would probably be the only one where I would wait. Now, how long would you wait? A month, maybe 2, but not forever. If you don't see any problems within 8 weeks, then I would go ahead and sign up for it.
There you go.
But yeah, that's a brilliant question. Thank you, Kathy.
Thanks, Kathy. Her line is now available, 407-422-1212. Let's look at this text line real quick. Why do labs have different critical cycle thresholds, and how does that affect results?
Okay, why do different? What I hope what he's asking about is the PCR.
Yeah.
And so what will happen with a PCR is that it's a replication of 2 times. So you take your sample, you extract the DNA or RNA in the case of COVID, and then you double it. So that's cycle 1, cycle 2, cycle 3, and you do it 40 times. All right. So what happens is a small amount of virus then turns into a large amount, or a small amount of DNA becomes measurable. This is how you can deal with identification of chemicals that are in very, very small amounts.
Okay.
If it's RNA or mRNA, or, this is the white DNA for that matter. So what cycle does it run positive tells you how much is in there. So if something goes positive, let's say at cycle 12, that is a much bigger problem than if it goes positive at cycle 37.
Okay.
So, that's how you can quantify how much mRNA is in your PCR sample.
I think the second one here is by the same person. What test would you do for a raised PSA if it's a benign enlargement, and what would be the treatment there?
What test would I do?
Yeah.
Okay, just the PSA itself is perfectly fine. If you're really going to get weird about it, you can go ahead and you can get CEAs. You may want to get, there are a number of different cancer antigens that will be helpful if you think that you may have something going on in the bone or going on in the colon. But generally, the highly specific PSA is sufficient. The question is how do you treat it? Okay, if it is not neoplastic, if it is not if it's not cancer, then what are the possibilities? One, you can have a prostate enlargement due to estrogen dominance. So if your estrogen level's over, let's say 35 or 40, you bring down the estrogen and the prostate will shrink back. And that takes 4 to 6 months or longer. Now, that's not an eternity, but that's as long as it takes. So what do you use to do that? You can use an aromatase inhibitor like Arimidex. I use diindolylmethane routinely in my male patients, because they're the only ones that have prostates, to lower estrogen and shrink the prostate back. Then there's some really cool little things that you can do, because if it's infectious, which is a distinct possibility, because 1/3 of all men over the age of 40 are going to have infectious prostatitis, causing their PSA to go up. So you use an antibiotic, and you can start off with doxycycline. You do it for 3 or 4 weeks. That will bring the PSA down. If it does, you got the diagnosis. The second thing you use is N-acetylcysteine, or NAC. It's a gram-negative antibiotic, and it does something really different. It thins out the prostatic secretions, so it drains. And just like any other abscess, when you drain it, it gets better.
Ooh.
And then if you want to get interesting, even more interesting, I use something called prazosin or terazosin. And these 2 medicines are your basic blood pressure medicines. But what do? They're actually like chemo agents for the prostate. So they're helpful even if you do have prostate cancer. So if you want to review that one, go to National Library of Medicine's PubMed, look for prazosin, that's spelled Prazosin, and then look prazosin and prostate cancer survival. And you'll see all kinds of articles written on it. Then do prostate cancer prevention, and you'll see even more articles written.
Oh, my gosh. All right.
So there are a bunch of things you can do for the prostate other than rip it out.
Let's go to the phones. We've got Rick. Hey, Rick from Lake Nona. How you doing today?
Yes.
You had a question about aspirin.
Yes, I take a high-capacity pharmaceutical-grade fish oil.
Yes.
A little bit of ginkgo biloba. Aspirin also is a blood thinner.
All right.
And I guess someone told me that you shouldn't be taking 81 milligram aspirin along with fish oil.
Why not?
Because it's too much of a blood thinner.
That's nonsense. Okay, I do it every day and have for years. Okay, I have my patients do it all the time. Why? Because what the fish oil does, it's not a blood thinner. It's not like you're using a 10-weight 40 oil in your car to thin the oil out.
No.
What it does is it decreases the stickiness. That is the viscosity, the platelet aggregation is really what the aspirin does. What fish oils do is they act like mayonnaise to a sandwich. So no, they don't increase bleeding appreciably at all. More so is they seem to be additive with regards to their ability to prevent stroke and heart attack. So one baby aspirin a day, 81 milligram aspirin, reduces your risk of heart attack and stroke by about 15%. By taking 1,500 milligrams of EPA and DHA per day, 1,500 milligrams or more, it reduces your risk of heart attack and stroke by another 15%. Wouldn't you know it? They work in different ways. I use both of them and have for many, many years. When I recently went in to have my CTA, which is a calcium score, it was 0, no plaquing at all.
There's the doc
What
bragging
about the
again.
ginkgo?
Ginkgo?
Yeah, ginkgo.
Ginkgo? I don't know. Ginkgo doesn't do anything. Ginkgo is called an adaptogen. You take it because it might give you a little bit of pepper up of energy, or it may make you sleep at night if you need to. Ginkgo biloba is one of those things that have been around for years, and I don't waste my money on it because it doesn't give me enough bang for my buck. So does it make any difference? The answer is no. Does it make you feel any better?
Yeah.
Who knows? It might. So, take your aspirin, take your fish oil, tell your friend to take a hike.
Oh, gosh. We titled the show Anti-Aging and What Is It and Does It Work? Teresa's checking in from Jacksonville.
Oh, cool.
75 years old. She says, have varicose veins and wants to know if she needs to be concerned.
No, only if you're in a bathing suit contest.
Oh, stop.
So what is it about varicose veins? They hurt. Okay, they're bothersome. A varicose vein has the diameter of like a pencil. These things are very, very nasty. They don't look so great, and they feel worse. Spider veins are not varicose veins. So people confuse the two.
Okay.
The spider veins also can hurt, but they are not much of a danger. The deal with varicose veins is sometimes they can throw off blood clots to the lungs, so you have to be careful how you deal with them. Is it anything to worry about? And the answer is no. You're 75 years old. You must have done something right. You lived a long time so far, and you'll live a lot longer if you take care of yourself. So do you need to go and have them mended? Only if they hurt. So if they hurt or if they itch, sometimes it pays to go ahead and do it. But, I did. I went in and had some taken care of because they run in my family, and, the itching was driving me nuts.
Right. You kind of reference this. This text here says, hello, Melissa. Hello. Can you ask the doctor's opinion on prostate artery embolization, please?
Yeah, what happens there is you go in and try to kill off some of the prostate by nailing the arteries that feed it. Really not the best way to do it. Okay. It was worked out a little bit. There are better ways if you want to kill the prostate. You can go in with radio frequency. You can go in there with cold. You can go in there with laser. There are all kinds of ways that you can burn the prostate back.
And just a sidebar, but we actually did a connection show, which you can find on the iHeart podcast. Just search connection show, and there's a whole show about prostate health and awareness.
And we did it just a few weeks ago.
Just did it, so go ahead and reference that. Lots of very good information in there. Stages of Life Radio, we're here for you. 23680 if you want to text in, or you can call us. We love talking to you as well. 407-422-1212. Taking a quick break, checking the bottom of the hour news, traffic, and weather, and then we will be back. Stay right there. Stages of Life Radio on News Radio WFLA Orlando. This is a shorter break, but we have some questions on the internet. Jane says, I want to use a bone supplement. Do you take all 6 at once, and do you take it with food?
All 6 at once? No. You can take 3 in the morning, 3 in the evening, and with food is the best way to go.
And it gets absorbed.
Yeah,
better.
and what you're looking at is a combination of vitamin K2, vitamin D3, and strontium. They can be taken simultaneously. It's not a big problem. But taking 6 horse pills at one time is a bummer. You know what I mean? It'll punish you. But, it is exactly what you need to do. So I had a patient, an elderly, not sure that elderly. The older I get, the younger the patients get. And her Z-score actually dropped 10. It was, minus 2.5, 2.6, and dropped to minus 2.1 and 2.2 with the K2, D3, and strontium. So does it work? The answer is yes, it does. How long does it take? And the answer is usually about 6 months, but before you'll see it on a bone density testing.
Okay.
And does it cost a lot? The answer is negatory, Batman.
Good.
It doesn't cost much at all. I really don't like bisphonates, things like Fosamax, Boniva, and whatnot, because these are poisons. And what they do is they poison an enzyme system that's necessary for regeneration and repair of bone. So if you want to look up something cool, go again on National Library of Medicine, PubMed, PUBMED.gov, or you can go on Google and get it dumbed down a good bit. But look up Fosamax and class action lawsuits. Look up Fosamax and then look up osteonecrosis, which is bone death. And then talk to the oral surgeons about how much fun it is for those guys to work on teeth in somebody that's taken Fosamax because the teeth fall out, the bone falls apart.
Fall apart. Hey, Barbara's got a question. She says she's interested in anxiety. No, you don't want
She
anxiety.
wants anxiety?
You really don't want that.
I can make you anxious.
She wants to know why it happens and how to control it.
All right. Well, it's a biochemical issue. You used to think that it was due to weakness. You were weak of the head.
Oh.
Well, what happens is that the brain is like a soup of neurotransmitters.
1 minute.
Some of them are inhibitory, some are stimulatory, and oddly enough, it gets even more interesting. Some of the inhibitory neurons are actually they're stimulatory for other areas. So there's like a reverse psychology with these neurotransmitters. So what will happen is you may end up with a serotonin imbalance. You may end up with a GABA. Chocolate's one, phenylethylamine. Or you may be looking at so serotonin, GABA, 5-hydroxytryptophan. These are and L-theanine. These are the neurotransmitters that you really want to do to treat the anxiety. So do you need a benzodiazepine like Xanax? No, you don't. GABA.
You really don't. No, you got to try something. Alan, we'll get your question on the next break. If you don't mind, stick with us. Next chance around here. Getting ready to go on the radio. We got some radio folk already tuned in on the phone. Wow, the phone's blowing up. And we still haven't answered all the questions over here.
We'll get as many as we can, but I still have to get to anti-aging.
Anti-aging, yes.
So what I'm going to do is I'm going to take out the question there about L-arginine supplement for nitric oxide, because that will be important.
Everything is important. We're just preparing. This is live radio, my friends. You can't get no better than this. Hello. Stages of Life Radio. I am Melissa Fox with 2 X's. Follow me on social media, won't you? Someone just said they heard us on the Florida Roundtable this weekend.
Oh, cool.
Yeah, thanks for that. I just took over that, and of course the doc will be helping me out here and there because, well, he's one of the experts in the field that I go to on a regular basis. Yes.
Every time she's sick, in particular.
Pretty much, yeah. So, all right, we got a phone call. We're going to get in real quick, and then we're going to talk about anti-aging. So let's get George in here. Hey, George, how are you? George, how you doing?
Hello.
Hi. Hey, George. George is 74 and from Orlando. You say you have a torn meniscus operated on 5 years ago, and it's hurting again?
Well, it's both these I got them operated on.
Yeah.
Because of the torn meniscus. Lately here, they've been kind of hurting, having trouble walking.
All right, George, I've been thinking about you, okay, because I took the old caddy out. And I was thinking, man, I just need to track.
it's
I need to track George down.
Okay, we got you. I remember you. Okay,
George is a good dude. He's been listening for a long time.
All of our listeners are good.
Yeah.
All right, now here's the deal with a meniscus. Okay, now have you ever picked up a milk pail? Okay, milk pail. There's a handle on it that can slide one way or the other. When you pick it up, you pick it straight up. But that bucket handle, okay, is sort of an odd thing. When you tear a meniscus, and they fix it, typically what they do is they go in and clip out the piece of cartilage that broke or that was torn up. And it's like that bucket handle. They'll go in, they'll clip it, cauterize, then get out. But it really doesn't fix the meniscus itself. It doesn't fix the cartilage. And then we continue to do something which is a good thing. We get older, okay, because it beats the alternative. So you're getting older, the wear and tear continues, and then eventually the cartilage that's in there will continue to wear out. So what I would be inclined to do, George, if it's been 5 years since they did the meniscectomies, they went and they removed the meniscal material that was torn or devitalized, I would go get an MRI of both knees again. Get a look at it and see whether or not the joints themselves are torn up or whether or not you broke off another piece of cartilage. If that's the case, you go back in, clean the joint out again. So you really don't have enough data.
Excuse me, Doc.
Sure.
I went to the doctor about 2 months ago.
All right.
And he took x-rays. and he gave me cortisone shots, and he said I was not ready for like artificial knee.
He said you were ready for him?
No, both.
He said that the joints are that deteriorated.
He says there's arthritis.
Yes.
In both of them because they were both operated on.
Yeah, well, you're going to have arthritis in your knees
he
anyway.
He shots of cortisone on both of them.
And then he told you that
it hasn't done much good.
Yeah, it's not going to. Yeah, shooting cortisone into the joints will actually tear up the cartilage even more. There are better things to be doing with the joints if you want to be injecting them. But the first thing that I would do would be get an MRI of the joints, to just do the knees together, get them both done, and see really what the structure is and what's going on with it. The x-ray itself is helpful because it gives you an idea what the bone density is doing. You can see the bony spicules, the things that you get with arthritis. So the two pieces of data, those two studies are complementary. You need them both. But I would be inclined to get a second opinion. Get somebody in there to look at it and say, yeah, this looks bad enough to warrant a replacement. But that's the natural progression. The older you get, the more likely it is that what's left of the meniscus, what's left of the cartilage, just goes away. But injecting cortisone is the sort of thing that should be a last resort, and it doesn't really help knees very much anyway.
Thanks, George. We appreciate that. We have a question on here, right here on the text line. Good supplement about increasing nitric oxide.
Nitric oxide.
Oh, yeah. What is this?
Oh, L-arginine. L-arginine is an amino acid. So we use L-arginine in combination with either citrulline or ornithine to increase nitric oxide. So the bodybuilders love this stuff. They think it's awesome because it makes the muscles look even more awesome because the veins start to bulge out. Oh, yeah. Yeah, it's narcissists love arginine and ornithine. They just love looking at themselves in the mirror. But the issue with nitric oxide is it's a transmitter. So your body creates an issue. So a nerve transmission goes down to the muscle, and then acetylcholine kicks out, the muscle contracts. Nitric oxide is used in certain chemical-to-chemical reactions. It gets released, and it is another transmitter. It has a duration of action of about 1,000th of a second. It's like a spark, and it's gone. It's in and it's out. But it's very, very necessary for blood vessel as well as other sorts of biochemistry to happen. So people focus on nitric oxide generally for one reason, and that's vasodilatation, where either in the heart, which is a good thing, or in the genitals, which is also a good thing. So if you're asking about the L-arginine to increase nitric oxide for treatment of ED, my recommendation is to use the arginine with ornithine and or citrulline. The ratio is 2-to-1. So let's say 1,000 milligrams of arginine to 500 milligrams of citrulline or ornithine. That is a great combination as a nitric oxide inducer. It's a vasodilator. The muscle builders love this stuff. Mm-hmm. Where else is it important? In the heart.
Okay.
Are there better ways to do it? And there may be. Dimethylglycine is, I think, a little bit better for that. But arginine and ornithine would work just fine.
Okay, so we've had questions about varicose veins. We've had questions about increasing nitric oxide. And you wanted to talk about anti-aging.
Yeah.
What does that really mean? Is it slowing down, not reversing?
Right. Well, the first thing is I want people to understand that when they see this, what it means. What does it mean, anti-aging? Does it mean we're going to reverse the clock? No. Okay, you can't reverse the clock. You can reverse, a tape. You can reverse a CD. You can reverse a lot of different things, but you can't necessarily reverse time. But what you can do is you can reverse some of the damage and you can reverse some of the ravages. What are the things that we're most interested in? If you're looking at spending money, cosmetic surgery. So you need an eye lift. You go ahead and you raise your eyes up, make yourself look surprised, which is what happens when it's done poorly. You're going, oh my God, you can't close your eyes, or around the mouth if you can't whistle. What's this all about? Do you in fact feel younger? You might feel a little bit younger. You might even look a little younger, if not a little funnier.
A little funny.
Yeah. But is that anti-aging? And the answer is no. How do you make the joints better? Like George just a few minutes ago, how do you prevent that from happening? That's anti-aging. If we could have gotten George 20 years ago, what I would have done with him well, George, you're a little bit over. I don't know George personally. I've never seen George personally, but let's just assume that he's a generic George right now, a George Castanza, whatever it is from Friends,
Costanza,
right?
yeah,
so
yeah.
Costanza. So you're a little bit round. You've got a little too much weight on. Your knees are taking a beating because you've been carrying around an extra 40 pounds for 30 years, and so how do you protect those joints from further damage? And the answer is anti-aging. So what's the prescription for this? It would be glucosamine sulfate, MSM, and hyaluronic acid. The combination is necessary to produce more cartilage, more lube in the area, the liquid that surrounds the joint, and to try to nourish things. Okay, is it something that's going to happen after the joint is shot? The answer is no. There are people out there now that are trying against time to do things like stem cell injections. Well, that seems to help. Yeah, it seems to help after $3,000 has come and gone, and you still have your old knees. So anti-aging is not the same thing as plastic surgery, although there are cosmetic surgery things that are done in and around anti-aging. So how do you take care of wrinkles? People think that getting old, you have to have wrinkles to the face. And the answer is no. And most people go, oh, he's going to start hawking, the toxins, Botox in particular. And the answer is no. I hate that stuff. Okay, it's a way to earn a living, kind of.
Yeah.
But it really doesn't get anybody anything. So how do you knock wrinkles out of a gal's face? Well, you can put her on a motorcycle. That'll do it. The wind will kind of blow it back. But short of that, there's some tricks that we do using something called estriol. So topical estriol with hyaluronic acid. It's about $80 for 2 months worth of this stuff. And you rub it in, and it knocks out the fine wrinkles.
We're going to start trying that over here. The fox is starting to get a little refined.
The fox looks marvelous.
Stop lying.
Yeah. So what else can you use? There are a lot of these little ditties that you can do to make yourself look a little bit younger. But what do you do to make yourself feel younger? What can you do to make the damage less so? So the young lady that called in a little while ago with the varicose veins. So once they get to a point where you can't walk, okay, things are a little bit out of hand. So if you know that you're developing varicose veins because everybody in your family has it and you can start to see a little bit of it, you start on horse chestnut. It's an herb. It firms up the veins so they don't break down. The valves don't break down. And is that anti-aging? And the answer is yes. Kind of a cool. Easy. It's $12 for 3 months. Cool. So is it expensive? Oh,
no.
$12.
StagesOfLifeVitamins.com. Just put in some stuff, in the little search bar. Boop. It'll all come up. Anti-aging, all that kind of stuff. You can do that. And you can also become a patient of Dr. Klein's very easily. 407-679-3337. They're open first thing tomorrow morning. Or go to stagesoflifemedicalinstitute.com. We've got more questions and lots of answers.
Or you can stop by and visit.
Yeah,
what the hell?
You can do that too. Give us a holler. We got a line open at 407-422-1212. Stages of Life Radio on News Radio WFLA Orlando. All right, we got, this is a short one, and Alan has a question. He said he wanted to give blood at the Red Cross the other day. They tested his hemoglobin and said it was 13. He said, I looked it up, found that 14 is typically the low end for a person of his age. He's 60. And what are the real numbers, and what's the easiest way to raise it?
Okay, more times than not, you'll end up seeing a change like that, and you're going to go, my God, it's 13 and it should be 14. Check it again and see really what's going on. Because the tests themselves are sometimes not as good as you might think that they are. It's not like on Star Trek, where you take that tricorder and you go over the patient and you get everything. You get all the data on it. It doesn't work that way. So recheck your data. The deal with the Red Cross is they don't have time to be repeating what they're doing. Although if I were getting a pint of blood out of somebody for free, I would rerun the test. Right. This one came back normal, and plug in. But what you take is iron, chelated iron. And so go to the health food store or go to stagesoflifemedicalinstitute.com and look up chelated iron and look at what's in it. And that's what you want to get. If you get ours, that's fine. If you get somebody else, that's fine. But more times than not, it's an iron deficiency leading to the anemia. Now, in women, especially young women, it'll come from heavy, irregular menstruation, and I rather doubt that that's the case here. But you do have to think in terms of whether or not you're losing anything in your gastrointestinal tract. So talk to your doctor about doing what's called an occult blood, fecal blood. Okay, and so you go ahead, you do a finger wag down below, get a piece of poop on your fingertip, and then see if there's any blood in the poop. That would be
And
something
you
worth
wash your
doing.
hands a lot.
Yes.
You know, just in case people didn't catch all that. I just want you to know.
Well, yeah, I mean, you wear gloves when you do the fecal occult.
This person been insistently calling. That's what we should call it. All right, hey, it's time to get back to the show here. What? Thanks, Alan, for your question. I'm just pointing fingers. It's what I do. Welcome back. Stages of Life Radio. I think this is our last segment. This thing goes so darn fast.
It flew.
407-422-1212. I have one line open for you right now. So if you've been trying, either call that or text your question in quickly at 23680. We also have people who have been watching us on our Facebook feed as well as Twitter, Twitch, and who knows, all those crazy numbers and letters.
I'm curious to know what they think about my hat.
I like your hat.
I like my hat, too.
Yeah. Boy, it really stretched to go over those headphones on that forehead of yours.
It did. That's just stretched over my head anyway.
Right,
actually.
right. Okay, so let's see what we have here is the anti-aging conversation. Now, you do a few things aesthetically, correct?
Yes, of course.
So tell me a little bit about that while we have a moment.
So when you're looking at aesthetic medicine, this is kind of a big deal. So we're able to knock the larger wrinkle things out of your face and elsewhere using radio frequency. Mm-hmm. It's kind of a slick little trick, painless. It takes a little bit of patience, and yet it works. But the skin tightening, the skin resurfacing, these things are all marvelous, but you don't really necessarily want to be doing this until you make sure that what's underneath it is healthy again. So it's a lot like being an artist. Before you go ahead and you lay a brush with paint on it onto a canvas, you have to properly stretch the canvas. Then you have to properly treat the canvas. Then you have to properly put a substrate down before the paint goes down. Otherwise, you're going to end up with a junky product. It doesn't work very well. And the same thing is true with aesthetic medicine. Before you start messing with people's faces, you need to find out what's underneath. So if you've got an individual who has too little estradiol in their system, too little estriol in their system, gal in particular, they're going to wrinkle up like crazy. So why do you necessarily want to focus just on the skin when you should be doing the entire body? Testosterone. Mm-hmm. You think that's just for men.
Oh,
well,
no.
Well, testosterone's not just for breakfast anymore. So testosterone is necessary in women to maintain bone density as well as libido, cardiovascular health, and to prevent dementia. So do you really think it makes any difference for you to have the finest, most porcelain-like skin and then be put in a box because nobody took care of your heart?
Oops.
So we have to make sure that all of the organ systems are addressed and tuned up. Diabetes, you don't think that that's something that you're just destined to have because you have it right now? I love getting people off of insulin. I like getting their A1Cs under 6. My goal is under 5.5. So I'm watching the television and these advertisements. I'm happy I got mine under 7. That's a failure in my world. Why? Because hemoglobin A1C, okay, is glycosylated hemoglobin. That is caramelized hemoglobin. That is going to do damage to your entire body. So if you have an elevated A1C, not only are you doing damage to the blood vessels, but you're doing to every cell in your body. Mm-hmm. So anti-aging is looking at everything. Dementia. So we're going to be doing a show this Thursday on the round table on dementia. Mm-hmm. So do you really want to hear about that? Nobody wants to hear about dementia until it comes down to what can you do to prevent it?
Or at least slow it.
Slow it down or prevent it. What are the treatable causes of dementia? Is the dementia that you think you have really dementia?
Could be medicine fog.
You betcha. There are lots of different ways and lots of different things that you have to look at in the treatment of the patient. So in terms of anti-aging, what good are you if you're Charles Atlas but your brain went to mush? Not so good. So there are treatable causes, there are measurable causes, there are in fact genetic causes that you can find out about, and we'll talk about that on Thursday as well. So what is anti-aging medicine? It is not just hormone replacement. It is not just nutrition. It is not just cosmetic surgery. It is looking at the patient as a whole. One large unit with multiple systems and balancing everything out and finding out and treating those issues that are out of whack. So how would you find out if you had a cortisol insufficiency? Okay, you can feel like crud. You can have, I have chronic fatigue syndrome. I have CFIs. Oh, gee, and because I'm a member of all the Poor Me groups, the support groups on Facebook. Nobody bothered to check your cortisol level. Nobody bothered to check your DHEA. Nobody bothered to check your pregnenolone. Nobody bothered to check you for autoimmune thyroid disease. You don't have a disease, you have a symptom. So in anti-aging, what you do is you look at the entire person, you strip it back like an onion, and then you reassemble it. It's performance medicine to make you perform like you are younger, not anti-aging. My dad was 92 when he passed away, and he should have lived longer. The doctors killed him. But when he was 90, my mom was in a nursing home. My dad was the supervisor for an 1,800 unit condominium. And so in this retirement community, being a single guy, okay, is kind of like winning the lottery daily.
We get your drift, sir.
Yeah. So I asked him, I said, Pop, what better blessing could you give your dad as a doctor's son? I said, Dad, would you like me to get you some Viagra? And he looked at me and he goes, heck no, that's for old people. So I thought, man, that's my dad.
Right.
That's what I want to do when I get older.
Yeah.
He's my hero. And in fact, he is. He's a good dude. But that's really what anti-aging is all about. He could swim an hour. He could get in the pool and do laps for an hour.
That's impressive.
Very much so. He took really good care of himself for the most part. Okay, he still smoked his pipe, so he ended up getting the usual mouth cancers they had to take care of. But other than that, he was just perfect in his age. He retired at 75, and he played for the last 15 years of his life.
Nice.
That's anti-aging.
All right, so we're going to have a live show again next week.
Yes, we'll be here. Oh,
We'll be here live.
Yeah, everybody else will be out of here. The doctors are closed. Their offices are closed down. We're open. And we will be live on Christmas weekend.
So we want you to make sure that if you have nothing better to do, you gather around the radio next Sunday afternoon at 4 o'clock as well.
Get your questions put together and get them up early.
Yeah.
Okay, if you call us and get a spot on that line before we come on, it guarantees you a spot in line there.
Yeah, it sure does.
So
it's
we're happy
the
for
truth,
that.
and we are happy to do it. Yes, most definitely. I had one question for you, and that was about your rapid testing. Is that still viable?
Yeah. Okay, if you're traveling, over this holiday, we are getting our PCRs out very, very quickly. So the rapid test is not the same thing as the RT-PCR. The RT-PCR is a rapid throughput PCR. We're able to get them in 24 to 36 hours routinely.
Wow.
Okay, this is the fastest in the country, and it's just marvelous. And so what you can do is we have office in Longwood, so we're there Monday through Thursday, except for this week coming up because I told the girls they could actually take a holiday. I didn't want to be the Grinch this year, but every other week we're open Monday through Thursday, and we come in Friday mornings if we're given a heads up. The office is also open in St. Augustine, so we have a lab there. They'll draw your samples, get it to the laboratory in Jacksonville, and we have a Jacksonville lab. So if you can't make it to Longwood, you can make it to St. Augustine.
Right.
We'll get your stuff done quickly so you can make it on your vacation and go where you need to go.
That way you can travel. And by the way, traveling by air is safer than ever.
No question. But coming back, depending upon where you went, you may end up being quarantined unless you can get an RT-PCR.
Bing, bing, bing.
So, what do you want to do? If it's just going to save you time. You can go to the hospitals. You can go to the doc in the boxes, and they'll take 5 to 6 days. We'll get it in one day.
Ooh. All right. So that number for COVID testing is 407-636-3945. Again, 407-636-3945.
Or go on travelpcr.com.
Even better.
That's travelpcr.com, and you can schedule it. Okay, it's pretty slick.
Happy holidays, whatever you're celebrating or not celebrating, just a regular day to you anyway. Have yourself a wonderful, blessed time with your family, Dave.
Likewise. Okay, have a Merry Christmas, Happy New Year's, and whatever holiday you choose to celebrate, it's all right and good with us.
All right, Stages of Life Radio. We'll see you next Sunday at 4.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr.